What if you can bypass medications and use imagery to relieve pain? Dr. David Pincus is a professor of psychology at Chapman University, and he joins us today to talk about some of his extraordinary work in this area. David, thanks for coming.
Thanks for having me.
You know, I deal with pain all the time as a cardiologist, and pain in the hospital is a big deal. As you know, we have whole teams for pain relief, and we have scales with there's different smiley faces to crying faces, and every is part of the standard of care. And here you wrote this book, Imagery for Pain Relief, and I've read it, and it's a fantastic book. It's very readable, and there's a lot of helpful hints. And I'm surprised I've not heard about this, and I'm really fascinated. Can you tell me what is this all about? What is imagery for pain relief?
Imagery as an intervention for pain relief is, if not the oldest, among the oldest interventions that exists in healthcare.
So I'm really out of touch, you're saying.
Well, you're not alone.
Yeah.
You can trace the history of using imagery to intervene with pain and healing back 20,000 years. An author named Gene Ochterberg has done a lot of work in that area. Now, the problem is, the late, great René Descartes in the 1500s suggested to us, quite wrongly of course, that the mind and body are separate. Now, we know better today, but you know, old habits are hard to bypass. So, you know, imagery, guided imagery, the imagination, imaginary, all of these words conjure up make-believe, fake, you know, woo-woo, you know, spiritual, not effective kind of things. And when we think of pain, we immediately think of injury, the body, things that you need medication and surgical interventions for.
So when you say, is imagery and guided imagery the same thing?
They're similar. We use the term imagery on the book because we wanted to be more broad and open-ended. A physician, anytime you're speaking to one of your patients, you are conjuring images up. So we wanted to include even just natural, you know, doctor-patient or nurse-patient interactions within the book. For example, if you describe, well, here's the surgical procedure we're going to do. We're going to cut into the flesh, and we're going to go through the muscle, and then there may be some bone that we need to move us. Crack. Yeah, crack is an image, right? Yeah. You can see the bone in the back of your head cracking. So these kind of things can actually increase patient anxiety, make healing outcomes worse, versus if you describe the healing process, you know, as part of your intervention as a cardiologist or surgeon or anyone dealing with people in pain, you can start to talk about, well, tingling is a sign of healing, or it may burn for a while, but that itchiness is really the repair of your tissue, and then people imagine that happening.
So they still feel the pain, but their perception of the pain is different?
Exactly.
Because you said in the book you can measure temperature, but you can't measure pain.
You can only measure it subjectively. So the tools and instruments that you described, where you have faces described from a very unhappy face to a very happy face, where's your pain, 1 to 7, it's always subjective, and the reason is that we don't have a direct physiological test for pain is because pain is a subjective experience. It's a perception.
So if I break your arm, those pain fibers are firing and transmitting the pain, but how it is up here is
it's based on your perception.
And that's what you're altering, the perception.
Yes. For example, people with phantom limb pain, the limb is gone. Yeah. These are folks who have had amputations. And it's not the nerve signals at the point of amputation that are causing the pain. They'll experience pain in the missing hand. Now, the old name for that was all in your head, right?
Yeah.
Now they call it central pain, which means the central nervous system is creating the signal, which means it's your brain that's creating it. It's the somatosensory cortex. So imagery, you know, pain imagery is just like any other perception. And it depends not just on the sensory stimulation, the nerve endings, but the meaning of the pain and the emotion in the pain. Quick example?
Yeah.
If you're playing football and you're hitting somebody and tackling them, that will hurt less than getting tackled, even though the collision is the same.
You're right. That's true.
Because the meaning and the emotion is different.
That's true.
If it's the Super Bowl and that hit, you know, ends the game and you've won, you'll feel no pain.
Yeah, that's a great example.
But if you're the one who's been tackled and your team just lost, maybe you have maybe you have back pain for days.
Yeah, that's a great way to understand it. So is this different than hypnosis, or is it a cousin of hypnosis? How would you?
I like the word cousin of hypnosis. Yeah. They overlap quite a bit. If you heard a guided imagery scenario or saw someone doing it, it would be hard to tell if it was hypnosis or not. The main difference is in the stance sort of the guide. With hypnosis, you're being directive and you're leading and you're putting in suggestions. With a guided imagery approach, you're typically more open-ended and just sort of asking, can you feel this? Or do you see this? Or could it be this or that?
So what is the best kind of pain? Like say you have chronic belly pain, or does it work for that, or does it work for like broken bones better, or headaches better, or musculoskeletal pain better?
In doing the research for the book, it was interesting to find is that it works equally effectively across all types of pain. And the common denominator is all types of pain have those three components to the experience: the sensory component, the actual nerve stimulation, the affective component, the emotion, and the meaning. So it works on all types of pain.
Oh. So say you have chronic I don't know if you can do this, but if you say you have a chronic headaches, and you probably not want to give up your pain medicines right away, but what would be some type of imagery that you would give to get rid of, say, a headache?
Well, if you're a person at home struggling with chronic headaches, one thing that you can start to do, you can counteract the natural tendency to avoid or sort of mentally run away from the headache. Because what you'll typically find is that when the pain gets big enough, you're trapped and you can't get away. So instead, with some controlled breathing, you can sort of close your eyes and try to relax into the pain a bit. So breathing into the pain, and then what people can do is, well, the simplest thing is to do some relaxation imagery, and maybe they have a favorite place that they go to where it would be better to have the headache, like a favorite childhood place. For me, it was the beach, on the East Coast. So I might go there in my imagination and have the headache there, until the pain medications kick in or until the pain resolves. Or you may go to the beach or a mountain cabin.
So you don't block the pain out of your mind. You take the pain to a nicer area. Is that what you do?
Exactly. Oh. It's a process of practicing acceptance for having the experience first. The great Leslie Greenberg, one of my favorite therapists, says when it comes to experience, you can't leave a place until you've arrived there first. So the first step is always to lean into or experience the pain more fully, that's why you need the guide usually, because most people don't want to do that. And you may also experience the pain, see if you can picture it as a metaphor, give it a size or a shape. And that's always there. A headache, a throbbing headache could be like a hammer hitting you again and again. It could be a nail through your skull. It could be, a bat to the back of your head. And that's quite negative, of course, but if you can conjure that image, then you may start to transform it. For example, to spread the pain, to make it broader and more diffuse. Spread it across the whole of the skull, and then maybe it could leave your head and fill the room as you breathe.
That's fascinating. So this has real scientific basis in the treatment, and it works, and maybe you won't get off of all your medicines, but maybe you can make your life significantly better without medicine.
Science is solid.
Very good.